This section will discuss short-term forecasting for infectious diseases. Different types of qualitative assessments and modeling outputs are useful at different horizons. Short-term forecasts predict disease burden in the coming days and weeks. Short-term forecasts are produced as a measure of potential disease burden and can be especially helpful for public health practitioners and decision-makers when determining communication strategies and resource planning. Example inputs for short-term forecasts can include surveillance data and measures such as RT, the time-varying reproduction number. Forecasts give a sense of the direction of change and the absolute expected burden of disease. These forecasts provide estimates, often over a few weeks, and include a measure of uncertainty. They are usually most accurate at short time intervals, and different types of forecasting models are used for acute outbreaks versus more predictable seasonal diseases. Due to variation among individual model methods, parameters, assumptions, and input data, ensemble models can be more accurate on average compared to any single model. Because combining or ensembling models is often beneficial, forecasting hubs have been established to bring together multiple models to show a more complete picture of potential forecasts. This is an example from the COVID-19 Forecast Hub, which predicts COVID-19 hospital admissions in the United States. It shows the different estimates in different colors alongside the ensembled estimate. Sometimes incorporating a variety of data inputs can improve short-term forecasts. This is an example from a previous forecasting model that CDC developed, which utilized both hospital admission data and emergency department visit data to predict hospital admissions in the coming weeks. Here at the date of the dotted vertical line, the black dots show what hospital admissions had already been reported. The forecast of hospital admissions that was generated using only the reported hospital admission data, shown in orange, predicted a decline. However, the forecast that used both hospital admission data and emergency department visit data in blue changed the prediction. The eventual observed hospital admission data are shown in the white dots. They much more closely mirrored the blue forecast that used both hospital admission and emergency department visit data. However, as with many models, a more complete evaluation of this model also showed instances when the emergency department visit data made no difference or was misleading. One way to evaluate model performance is through coverage, which examines if the prediction intervals of a forecast contain observed data. The figure shows national weekly observed influenza hospital admissions in black dots, along with an ensemble forecast with 50 and 95% prediction intervals shown in green. When observed data fall within the prediction intervals, the forecast was successful in predicting future values. When the observed data do not fall within the prediction intervals, the forecast failed at that point in time. It's important to evaluate model performance to ensure that the various combinations of data sources and the model are the most informative they can be for public health decision-making. Short-term forecasts can predict disease burden over days and weeks, and they can be enhanced by incorporating multiple models and data inputs.